Yeah. Uh, Assalamu alaikum. Assalamu alaikum. আমি ডাক্তার ফরিদ আহমেদ, অর্থোপেডিক সার্জারি, ডিপার্টমেন্ট অর্থোপেডিক সার্জারি, জালালাবাদ ডায়াগনস্টিক মেডিকেল কলেজ হসপিটাল, সিলেট. Today our class is about exam oriented. Exam. Orthopedic surgery examination needs and final proof. Final proof. This is your final destination for being a doctor. Orthopedic surgery, there are short case and long case. Normally there is no short case, long case from orthopedic surgery. Short cases from general surgery. Short case during exam, during the day of viva exam, you have to face short case, long case, and viva. First, you start with long case. Then, in between long case, you have to face the short case. Short cases are almost selective. Most of the cases there is swelling. Swelling. Those cases are available during or before examination. This may be a case of lipoma or neurofibroma or ulcer or hernia or hydrocele. So, how many cases? One is swelling. One is swelling, then hernia or hydrocele, then ulcer. Okay, swelling. Swelling when you face short case in swelling, you have to we ask examine the swelling for undergraduate exam. Or post-graduation exam, we ask examine the patient. So almost same thing, but you are the examining of final prop examination. So we ask examine the swelling. Swelling, for any swelling, any examination in our orthopedics department, there are three things: look, feel, and movement. Look in general surgery or medicine is called inspection. Feel is called palpation. We have no auscultation. So, we see the movement. Look, look, look. In look, we in look we face sight. What is the side of the body? That means flexor surface or external surface, or it may be the region, cubital fossa, or scapular region, or buttock, or popliteal fossa. Site. Then size you have to measure approximate size. Approximate about in we express in centimeters. That means it may be uh, 8 centimeter into 10 centimeter, like that. So site, size, shape. In case of shape, which is rounded or globular or pisiform or diffuse or then margin. Margin, margin is regular or irregular, smooth or 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 irregular. This is margin. Side, size, shape, margin, and it is fixity. Is it fixed on the underlying structure or not? If it is fixed to the underlying structure may be muscle or fixed to the bone. If it is, and then consistency. Consistency. What are the types of consistency? Very soft, like jelly. Then soft, firm, hard, then bony hard or stony hard. Soft, like very soft, jelly like. Very soft. Soft, then firm, then hard, then stony hard or bony hard. Rigidity. Is it fixed with underlying muscle or skin or bones? Osteochondroma. It is fixed with the bone. And Other structure like lipoma, neurofibroma, this is affixed with the underlying muscle or nerve. Okay. So during exam, we ask if it is case of lipoma, then we ask what are the types of lipoma. Then you can tell your answer will be it subcutaneous, intramuscular, subcutaneous. Okay. And the peculiarity of lipoma. Lipoma is peculiarity is slippery, slippery. Then we ask you, show me the sleeping sign. Then you have to examine, you have to show us the sleeping sign. Okay? Then we can ask, is it benign or is it malignant? This your answer will be it is benign tumor. If it is malignant, then what is the name? Lipoma, then liposarcoma. Okay. What are the differential diagnoses? Like you can your answer will be it will be the neurofibroma, schwannoma, osteomorphism. You have to differentiate the neurofibroma. When you press the neurofibroma, the nerve distribution area, patient feel pain. Okay, and then lipoma is almost non-tender. Okay, sight is look, then feel, feel temperature, tenderness. Is it margin? You have to take the margin and rigidity. Move. Move means is it move side to side or above downwards. Is it move with movement of the limb? This is all about lipoma. Then then our answer will be what is your, what will do now? If patient feel pain, then needs surgery, or it is cosmetic purpose, or it is mechanical problem. Mechanical problem means is patient lipoma on the back of the chest or trunk. Patient feel pain during sleeping or lying down. If it is on the buttock, patient feel pain, then needs surgery. Otherwise, it may transfer into malignant. If no symptom, no treatment. Okay. Then there is hydrocele. Hydrocele, we have to examine the hydrocele. Then we ask you what is hydrocele? What are the types of hydrocele? What is your how you can differentiate hydrocele from hernia? You have, in the case of hydrocele, you can find get above the swelling, but in case of hernia, it is get above the swelling is negative. And reducibility. In case of hernia, it is reducible most of the cases, but in strangulated hernia is irreducible, and lipoma is hydrocele is irreducible. Then when and consistency, transparent test, we can see that past light can go from one side to another side. Then we ask when it is not possible to pass light, when it is filled with blood, or when it filled with sac is filled with lymph or pus, biocele, then cannot found the then transparent test is negative. Okay. Now ulcer. In case of ulcer, we have to see the look, feel, and movement. In case of look, you have to feel the is it size, shape, margin, and base. And finally, you have to examine the regional lymph node. Sight, which side of the body, size, size. You can measure approximately. It may be 10 centimeter or 5 centimeter. If size is 10 centimeter, but if about 10 centimeter, you tell it is 3 centimeter, it is not correct. You have to give the idea almost. You can remember this is one finger is 1 centimeter. Okay, one finger breadth is 1 centimeter. Okay, approximately. Then finally, in case of ulcer or in case of swelling, you have to examine the regional lymph nodes. Then we ask, try ulcer, classify ulcer across the margin. You can see when it is undermined, then it is tubercular. What is the edge? Sloping edge is healing ulcer. Everted is and pumps out is septic ulcer, and when its margin is rolled out, it is malignant ulcer. And when we examine the lymph node, regional lymph node, we have to classify what are types of lymph node, which lymph node can involve, and what are the one lymph node is matted, one lymph node is enlarged, one lymph node enlarged and tender. Okay, matted in case of tuberculosis, enlarged it is infection, enlarged tender is malignancy. Okay, this is the all about short cases. Then you have to face the long cases. Long cases mostly in our country. This is polythiasis, mineral stone, gastric outlet obstruction, pyloric stenosis. So all cases. You have to face the case according to your patient. Which patient you examine. If you found a polythiasis, then you have to show the Murphy's sign, what is the Carrot's triangle, how you can divide the abdomen in 9 segment. This is, and what is the technique of operation? Which one is better, laparoscopic cholecystectomy or open cholecystectomy? Which one is per? And nowadays it is the laparoscopic cholecystectomy is the right answer. Then you can ask what is the complication of laparoscopic cholecystectomy? It is portal hernia. What is the portal open for laparoscopic cholecystectomy? We can ask. Then renal stone. If patient if found renal stone, what are the type of stone? What are the what are the how we can differentiate is renal stone or it is pyloric, it is uteric stone. Okay, then you have to face the viper. So during viper day, you have to first face this short case, then long case, and finally you have to face the viper. You have to face two board. One is short and the one is long. Short board and long board. Everywhere is 18 minutes is fixed. 18 minutes. 18 minutes fixed. Then bypass. If you have to face everything from general surgery, urology, hepatobiliary system, GIT system, bariatric surgery, anesthesia, orthopedic surgery, everything. You can ask about anesthesia. What are the type of anesthesia? It is answer is general anesthesia and regional anesthesia. Regional and general anesthesia. Then we ask what are the complication of general anesthesia. Then we ask what are the complication of spinal anesthesia. Spinal anesthesia most common complication is hypotension. That's why what the precaution we take? We preload the fluid, at least 500 fluid running IV. Preload. This is called preload. Hypovolemia and spinal headache. Other complication and spinal shock, retention of urine. So that's why needs catheterization in patients. Okay. Then we ask, what are the operation you see in operation theater? Done spinal anesthesia. Some people tell like that this is cesarean section, cesarean section, total abdominal hysterectomy, vaginal hysterectomy. Your answer not like that. Your answer will be all gynecological operation. What is the operation done under spinal anesthesia? Your answer will be like that. I will repeat again. Your answer will be like that. All gynecological operation. All operation around perineum. That means fistula, hemorrhoids, hernia, hydrocele, and all operation in lower limb. We can done under spinal anesthesia. So okay, this is answer is all gynecology operation, all operation around perineum, and all operation around all operation orthopedic surgery, lower limb surgery. Okay, three things. Then we ask what are the complications. Your answer will be during operation, hypovolemic shock and anaphylactic shock, post-operative retention of urine, and spinal headache. That's why what is the precaution you will take for hypertension needs preload. What is what is the precaution you will take for retention of urine needs catheterization. What precaution you will take for spinal headache? First 24 hours patient will be lying down most of the time except except feeding. Otherwise, first 24 hours needs patient lying down. Okay. Then we'll ask what are the complications in general anesthesia. General anesthesia during we can divide it during induction, during anesthesia, and post-operative complication. During induction, we anesthesiologist intubate. It may enter wrongly in the stomach. Means trachea. Trachea and esophagus is very close, so it may enter into the esophagus. Okay, so you have to be careful that. And during operation, cardiac arrest, postoperatively, this hypotension, retention of urine, and myocardial infarction. Okay. Then, if you found any in patient in posted need posted operation nowadays, we urologist done TURP transurethral resection. Which one is better? Open or close? Always best transurethral. Okay. Then you have to face the orthopedics. Orthopedics viper, you have to face what is compartment syndrome. Compartment syndrome, you can define the raised intercompartmental pressure within a closed artificial tunnel, either in the legs or forearm, to threaten the encircle muscle vessels. In viper, we ask, what are the signs of compartment syndrome? Your answer will be pain, pallor, paresthesia, paralysis, falseness, pain on passive extension. All are six. There are six P's. I repeat again: pain, pallor, paresthesia, paralysis, falseness, pain on passive extension. Pain, pallor, paresthesia, pain, pallor, paresthesia, paralysis, falseness, pain on passive extension. Okay. Now, what you will do the compartment syndrome? You have to prevent tight bandage and monitoring of the patient. Okay. Then you can ask. What is the what is tumor? You can ask what is tumor? Tumor is an abnormal mass of tissue, the growth of which exceeds and uncoordinated with that of normal tissue, persists in the same excessive manner after cessation of stimuli, which evoke the same changes. What are the types of malignant tumor? Primary, it is, benign or malignant. Benign and malignant. Then we can ask again, what are the types of malignant tumor? Primary malignant tumor and secondary. For bone, primary malignant tumor is osteosarcoma, Ewing sarcoma, multiple myeloma, fibrosarcoma, chondrosarcoma. Then what are the secondaries? Secondary, that means it arises another place and deposit in the bone. You can say from above downwards like that. Or it arises from thyroid, breast, lungs, prostate, kidney, and zetat. You can ask this is from thyroid, breast, lungs, prostate, kidney, zetat. Okay. Then we can ask what are the how you can differentiate. This is malignant. Malignants deposited in this osteolytic lesion, but not in every cases. If it is tumor at the site of origin, thyroid, breast, lungs, prostate, kidney, zeated. If tumor originate from prostate, it is osteoblastic. It means bone is forming. Other tumor is osteolytic. Osteoblastic in case of prostate 90% and 10% is osteolytic. But in other tumor is 90% is osteolytic and 10% is osteoblastic. Okay. So what is Ewing sarcoma and osteosarcoma? Osteosarcoma arises from endothelium of the bone marrow, which is first decade to second decade. So that means the 10 years to 20 years. Which places bone, which side of the bone is involved? Mostly metaphysis of the long bone. Mostly metaphysis of the metaphysis of the long bone, mostly around the knee joint. That means distal femur and proximal tibia. And radiological examination, it is in case of osteosarcoma, osteoblastic and osteolytic lesion. It is sunburst in appearance and it is Codman's triangle is positive. What is the region in Codman's triangle positive? Osteosarcoma, Ewing sarcoma, and osteomyelitis. Then we ask Ewing sarcoma, which age is most common? The first decade to second decade. That means 10 to 20 years. Which side of the bone is involved? Is is on the metaphysis of the long bone. Metaphysis of the long bone. Metaphysis of long. What is the radiological finding? Onion peel appearance is originated from endothelium of the bone marrow. And osteosarcoma is originated from mesenchymal tissue. Okay. Now you can ask infection. What is osteomyelitis? It is inflammation of the bone and bone marrow. Inflammation of the bone and bone marrow. What are the type of osteomyelitis? It is acute, chronic. Acute. One patient present within 72 hours. It is called acute osteomyelitis. One patient present more than 2 weeks. After 2 weeks, it is called chronic poisoning osteomyelitis. In between 3 days to 14 days, we call it is subacute osteomyelitis. Then we ask, what are the organisms responsible for osteomyelitis? You can tell it's a specific organism, non-specific organism. Specific means tubercular, syphilitic, fungal, parasitic, and non-specific means Staphylococcus aureus. Staphylococcus aureus is responsible for 70% cases. Streptococcus, Salmonella, Shigella, Proteus. Then we ask, what is the which organism affect which children which are affected by which organism? Your answer will be Haemophilus influenza. Haemophilus influenza. What is the route of entry for neonate? Is from the umbilical cord. Whatever it is, through umbilical cord. Okay. Then pathological fracture. We ask, what is pathological fracture? Your answer will be fracture of a bone, the bone of a already been disease. During exam, you have to remember many definitions. So, in short, simple and easy way, you can remember. Okay? Fracture of a bone, the bone already been disease. How we can tell is congenital. Congenital means osteogenesis imperfecta, baby born with multiple fractures. Infection, osteomyelitis. Inflammatory, ankylosing spondylitis. Carcinogenic, means osteosarcoma, Ewing sarcoma. Others or miscellaneous, osteoporosis. Okay. This is a pathological fracture. Then we can ask, what is fracture? Fracture, anatomical break of anatomical content of the bone or periosteum. Classify fracture clinically. We can ask, classify fracture clinically. Your answer will be the simple or closed fracture, compound fracture, or open fracture. What is compound fracture? When fracture communicate exterior, it's called compound fracture. How we can differentiate, classify compound fracture? Gastelum and Anderson classify compound fracture into type 1. Type 1 means one fracture less than 1 centimeter. It's called type 1 compound fracture. When more than 1 centimeter but less than 10 centimeter, this is called type 2. Type 2 compound fracture. Type 3 is wound size is more than 10 centimeter contaminated, then we call it as type 3 wound. Type 3 again classified into 3A, B, and C. A, which one is type 3A? 3A means one adequate amount of soft tissue to cover the wound. Type 3B, 3B, one not adequate amount of soft tissue to cover the wound. 3B. 3C is any size of the wound but associated with vascular injury. So, it is if it is vascular injury, then we call any type of wound with associated vascular injury. It is we call it type 3C compound fracture. Okay. Then we ask specific fracture, neck of femur fracture. Neck of femur fracture is radiologically in type. This is called garden type. Type is type 1 is incomplete fracture. Type 2 is complete and undisplaced fracture. Type 3 is complete with partial rotation. Type 4 is 4 is complete fracture with rotation. What is the treatment of option of fracture neck of femur? Any age needs surgery. In case of children, that means if age is below 14 years, we need the no spin or CRI, that means close reduction internal fixation by no spin. Nowadays is pediatric DHS is available. Pediatric small size DHS is available, so we can apply the pediatric T is a dynamic hip screw. In trochanteric fracture, from 14 neck fiber fracture from 14 to 60 years, we need cannulated hip screw. Cannulated hip screw. After 40 to 60 years, we did a replacement hemiarthroplasty. Replacement hemiarthroplasty. In a written exam, on the treatment option of neck finger fracture in children, adolescent, and adult. This is your answer. In children, we apply nostril or pediatric diseases. In 14 years to 60 years, we did the cannulated screw, and after 14, after 60 years, replacement hemiarthroplasty. In your written exam, sometime what is treatment option of intertrochanteric fracture in children or older adult? In all age, intertrochanteric fracture needs dynamic hip operative treatment is dynamic hip. Then supracondylar fracture. What is supracondylar fracture? Supracondylar fracture in which age is most common group? 2 years to 10 years. Mean age is 8 years. What is the mechanism of injury of supracondylar fracture? Fracture fallen autistic hand. Fallen autistic hand. How we can classify it? It is anterior or flexion type, posterior or extension type. Posterior or extension type again classified into three types. Undisplaced, this lateral classification. Undisplaced, displaced, minimal displacement that still posterior cortex is intact. Type 3 is displacement with rotation. Displacement with rotation. And type 3 again classified into medial and lateral. This posterior medial and posterior lateral. If this fracture line is posterior, but is on the medial side, it is called posterior medial. If it goes outside, so on the medial side, it is called posterior lateral. Another treatment option of spondylar fracture is which undisplaced or minimally displaced means long arm Drexler. If it is displaced with rotation, needs under anesthesia, we will try to reduction. If it is reduced, then we can apply 2 KY, or if it is not satisfactory reduction, then needs open reduction internal pulsation by KY. What are the complication of supracondylar fracture? Complications immediate and late. Immediate means injury to the brachial artery, injury to the median nerve, injury to the bicep tendon, injury to the ulnar nerve, injury to the radial nerve, okay, and compartment syndrome. If they apply local anesthesia, if they apply local bandage, then late complication is malunion. Malunion means Cubitus varus or valgus. Cubitus varus, or if it is bending medially, it is called cubitus varus. If it is bent laterally, it is called cubitus valgus. Then malunion, then VIC. Then stiffness, if cubitus apply bandage, in stiff position is stiffness. And finally, we tardy ulnar palsy. Tardy ulnar palsy. Okay. What is VIC? This is a late complication of compartment syndrome. VIC in type 3, mild, moderate, and severe. Now, college fracture. What is college fracture? Every three student we can ask what is college fracture. College fracture defined as a fracture distal end of the radius within 2.5 centimeter from distal articular surface with the radial fracture of the ulnar steratosis. What are the morbid anatomy or types of morbid anatomy? Morbid anatomy is dorsal angulation, dorsal displacement, lateral angulation, lateral displacement, spination and impaction. There are six types. There are six. There are this morbid anatomy is six type. This is dorsal displacement, dorsal angulation, lateral displacement, lateral angulation, supination, and impaction. Which age group is most common for Colles fracture? Now we are called this fracture distal radius. Before it is called Colles fracture. Most common affected people are osteoporotic postmenopausal women. Osteoporotic postmenopausal. What are the mechanism of injury? Fallen out testis. Then we ask, what are the injury occurs due to fallen out testis? Your answer will be like that: fracture is scaphoid, fracture Colles fracture, fracture distal of the humerus, humerus, vertical fracture, surgical nerve of the humerus, fracture clavicle. All are same mechanism fallen out testis. Okay. The treatment option of under anesthesia will reduce the fracture and apply long arm backslap for 1 week. After 2 weeks, we apply the long arm pull plaster. And another 2 weeks, when the total after 3 weeks, we apply the short arm, short arm plaster. It is called polish plaster. We keep free the elbow. What are the complication of polish fracture or fracture radius? Immediate injury to the injury to uh, injury to the radial nerve, injury to the median nerve, injury to the flexor longus, compartment syndrome, compartment syndrome. That complication is stiffness, malinium, shoulder hand syndrome. That is frozen shoulder. Patient keep the plaster in like that. They don't move the finger and also the shoulder. So gradually they stiff the finger, metacrophlangeal and interphalangeal joint and shoulder joint. So how we can prevent? By preventing the exercise, just after application of plaster, we can we can we can uh, start rehabilitation. We can start physiotherapy. Okay, and we can also apply the or ask the patient for shoulder massage like this, like this shoulder movements. Okay, and movement of the fingers like this, the finger like this, and after 6 weeks, we remove the plaster and then move the wrist movement like this. Or, okay. This is our all about the Colles fracture. And also, Sudeck patient develop Sudeck osteodystrophy. Sudeck osteodystrophy. Now, the fracture clavicle. The mechanism of clavicle fracture? Fracture of fallen out testis, which is NES. What is the treatment option of clavicle fracture? Then which side? Which side is most commonly involved? at the junction of the medial two-third and lateral one-third. Why this area is mostly affected? This is the meeting point of the two curvatures. Both sides are strong muscular attachment and nutrient foramen enters one in this place. So one enters, which side enters the nutrient foramen is almost weak. Okay. Then treatment option. You can apply arm sling or collar cuff for 2 to 3 weeks. For children, 2 weeks. For extremists, 1 days, 2 weeks. Uh, Sorry, and for adult, it is 3 weeks. What are the complication? Injury to the uh, injury to the uh, structure lying below the behind the subclavian vessels, and injury to the pleura, injury to the lung, and the later complication is malunion, non-union, or stiffness of the shoulder joint. So this is all about osteoid fiber. Fiber is a very simple but wide extension. It means the question is simple, but you have to learn more. So this is all about orthopedic surgery, and try to read and fetch the fiber. Okay. Thank you. Thank you very much. Thank you everybody. Anwar, কতজন ইনভলভ হইলো? নিচে শেষ আর কত নেব?